If I traded it all.
Welcome back. You know, I forgot to say we were live on Facebook before, but we've been live. We're going to be live all day now. So, hi, like us, follow us, and I'll be sharing the show afterwards. I'm very excited about bringing on my next guest. This is very interesting. So listen up, everyone. Okay. My next guest is Mary, and I want to say it right, Amy Jutes, and she is the owner of RN Patient Advocates of Scottsdale. Welcome to the show. You must tell everybody a little bit about yourself and what you do. And it is amazing what you do. So thank you for what you do.
Thank you so much, Carol, for having me. So, you know, I've been a nurse for more than 25 years. I have had a lot of different experiences, a lot of different places that I've worked, things that I've learned. I can tell you in 2010, I went to a class in the University of Arizona College of Nursing and learned about patient advocacy. I can tell you that everything that I've done up to this point has gotten to me this place, and I feel like I have been put in the right place. You know how you find out when you're in your right place?
Right, when you know it.
Yeah, you definitely do.
That's awesome.
So physical medicine and rehab, medical surgical nursing, clinical research, oncology, and, you know, all of those things have helped me get to this place.
So explain what it is that you do, because it's pretty amazing.
So I can say in a nutshell, it's taking the fear out of making medical decisions. So the medical system is very confusing. Wouldn't you agree?
Absolutely. A lot of people don't do what they should do because it's so confusing.
Well, and I think when you get into an area where you're not used to, where you don't understand the words and the language that's being used, you can get off on a path that you don't expect.
Sure.
So, and medical errors are a real thing. 40% of the people surveyed have said that they've been experiencing a medical error, and 30% say that it is lasting. So it is important. There's medication errors, and then we have fragmented care. So 70% of the medical physicians are specialists. Only 30% are primary care, and I actually think that that's dropping. Many people are having a hard time finding a primary care doctor. So if you don't have someone at the helm, somebody managing or directing your care, it can be very confusing, and doctors don't communicate very well.
Right.
It's a matter of time.
You know, I also thought of it too when you were talking just now, as there's a lot of people that get, you know, dealt a card that they didn't expect to happen in their life. It could be, you know, cancer, a terrible thing such as that. It could be anything, diabetes. There's so many things that you can come up with that can be thrown at you. And then all of a sudden you're going down a line. And I don't know if this is true or not, but I feel that a lot of doctors tend to, you know, you end up doing way more than you ever need to really do sometimes. Is that correct?
It is. You know, when you get a new diagnosis or maybe even a lack of diagnosis, or if you have multiple chronic diseases, many people have more than 5 chronic diseases, or if you have an out-of-state family member, right, that you're worried about and you don't know what exactly is happening to them and whether they're communicating effectively with their physician, that is very confusing. And we don't know what we should be doing. And, you know, there are some places that individuals can go, and I can teach them about websites like choosingwisely.org, where you can actually go to that website, and each one of those physician specialty groups have the top 5 things that are overprescribed, or tests that are overprescribed. So it stimulates a conversation with the physician. Is it really needed?
Well, I have to ask you, because that's what a lot of people would say, that is it really needed? You're saying yes. When would somebody call you? When would the time be to have someone like you work with them?
Well, you know, everybody's crisis is different. I have individuals of all ages that call me. I don't really work with infants, but my youngest was 12. The oldest is 96. And I can tell you that, you know, everybody's crisis looks different. Sometimes people don't even know what their crisis is. So a new diagnosis, a new cancer diagnosis, I can tell you that most people don't know that they have a right to a second opinion. And that goes even with your chronic diseases. In my personal business, each person that comes to me, I offer them not only traditional medicine, but integrative and functional medicine as well. So I help guide them down roads that they're willing to go down, and then maybe roads that they aren't as familiar with.
Wow, that's awesome. So I'm amazed by what it is that you do. Now, all your information is on the website.
Yes, it is.
So the website is RNPA of Scottsdale. You can also call her. Now, this is a number that you're listening to this information. This is huge. Maybe it is you, and maybe it is someone you know. I've been saying it all day today. I say that a lot. But I love that because you get to, hear this information, be something you may never know even existed. And here on Networking Arizona, you're hearing it. And her phone number direct, it's 480-703-0699. You work primarily in the Northeast Valley.
Correct. I used to cover the whole valley, but I've been in business for 8 years, and my pizza delivery area has gotten a little smaller because more people have heard of patient advocacy overall, and specifically me. And so I get a lot of phone calls, and I think being on the road, you have to focus. I, however, have been in 13 different hospitals here in the valley, and feel pretty confident that I can get people where they need to go.
So you do a free consultation, you say, with everyone. And how does it start off with? Usually when they call you, it's not like we're giving away a weed whacker right now, but there's nothing that we can do, but it's something that people may write down now and do something later. You never know. A lot of people are like that, aren't they?
Yeah, they are. I think, again, this is such a fairly new service that's out there. And I can tell you also that individuals aren't all nurses that do this. I've been trained as a nurse, and I think that what makes me different is that nurses can predict what's going to happen as opposed to cleaning up the mess later. Or afterwards when there's a challenge. So I would say that, people will call when they're in their own crisis.
Now, there's a process that you wanted to go through, and because you said that most people, like me right now, I'm sitting there looking at her going, wow, this is really cool, but what exactly do you do? So you said that there's a process that you have to help people understand a little bit more.
So, like I said, I was one of the first here in the Valley to even do this kind of job, and so I had to come up with a way of explaining it the easiest way, and I came up with a CARES acronym. CARES stands for communication, advocation, to be an advocate, research, education, and ultimately safety. And the way that that's described helps keep things focused and help people remember what it is, and maybe remember when the time is to pick up the phone and call.
And when you work with somebody, because I know I can just think of somebody right now that would be perfect, they call you. They tell you what's going on. And then what do you do?
So the first part of what I do is I find out what their main issue is. But I can also be honest with you, many times people don't understand exactly what the main issue is. They think it's one problem and it could potentially be another. So when I use that acronym CARES, communication is the first thing. So I collect medical records. I get them to sign a HIPAA form. I collect medical records from each one of their physicians, and then I actually prepare a medical timeline, which is the individual's paperwork. So a lot of times we don't know what's actually in our medical record, which can be an issue going forward, right? So if somebody has an allergy to something and it isn't actually in their medical record, or a client...
Happened to me one time.
Yeah, and
so
it's hard to get that changed.
Right. Oh, yeah.
Yeah. So, I had a client in one of my early years of doing this, and we found out by collecting his medical records that his primary physician was not listed correctly. So his specialists were all sending his medical records to the wrong primary physician for 3.5 years. Amazing.
We're going to go to a break.
Okay.
And when we come back, we want to talk about a little bit further about what it is that you do. And we're going to go through more of it because it's so interesting. But people need to understand that this is something that you may have never even known existed that can help in so many ways, especially if you've been thrown something like a new, I want to say disease. What's the right word?
New diagnosis.
Diagnosis, thank you. That's why I needed you. But really, honestly, sometimes things happen to people and you don't know where to go. You don't know where to turn. This would be a great start. So their number to call her is 480-703-0699. It's RNPA of Scottsdale.com. Hang tight. We'll be back.
Are you tired of shooting paper? You do realize that you will never get into a gunfight against a paper target. Reality-based training is the next level, and Marauders Tactical Training can help you get there. We conduct live fire and non-lethal training force on force at 3 different locations around the Phoenix area. Marauders.us is where you can get more information or contact us at 602-326-9849. That's 602-326-9849.
If you're listening to my voice right now, chances are you or someone you know is struggling with opioid addiction. This epidemic has clearly shown us addiction impacts everyone. No more stereotypes, no more judgment. We need treatment that works. Recovia is an integrated program for chronic pain and opioid addiction. This includes physical therapy, safe detox, and behavioral health under one roof so you feel like you again. There is hope. Visit Recovia.com or call us at 480-712-4600.
Have you heard all the hype about investing in real estate? Real Estate Knowledge Institute teaches you a no-nonsense approach to investing. The founders of Real Estate Knowledge Institute have done it all and currently do it all. Learn from active investors how to approach things differently. Don't wait another day to improve your life through real estate. We're hosting live training sessions throughout the country to help people just like you get started. All you need to do is call 623-500-2000 or visit realestateki.com to sign up and start learning strategies to improve your financial future through real estate investing.
Are you the parent of a high school freshman, sophomore, or junior who plans to go to college? We've reached a point in time where college is criminally expensive. Hi, my name is Scott Rulon with Rulon Financial. We offer a free 1-hour consultation to the parents of high school students. We will talk about the price of college, how to get better test scores, and most importantly, how to make college affordable. For more information, give us a call at 602-824-2299 or visit our website, rulonfinancial.com.
Hi, Solar Sandy here. Currently, you're buying expensive power from your power company, paying fees, taxes, and all kinds of charges for your electricity. I want you to save money on a bill you're already spending too much on, and it's going to keep going up. To get saving with solar, fill out my kilowatt worksheet, and then I come to your house to show you how many panels you need and how much PYOP, producing your own power, will save you. No more high electric bills. It's really quite simple. Now you produce your own power and pay less for it. Go to my website, AskSolarSandy.com. That's AskSolarSandy.com.
Do you feel like tackling your credit card debt or your student loans is a chore? At T&H Financial Coaching, we make being financially fit fun. We offer one-to-one coaching that will help you become financially free to live the life of your dreams. Call or text T&H today at 480-353-9849 or find us on the web at tandhfinancialcoaching.com.
If I traded it all,
So welcome back. I'm losing my voice again, but I know I'm better now. Now, I know that you had mentioned that you wanted to go over kind of like the communication part of this. Again, I want to talk to everybody out there that's listening that did not, just is turning in. This is Mary Amy Jews, and she's the owner of RN Patient Advocates of Scottsdale. And the reason why I want to bring this in again, because people have to listen up. This is something that I've never had anything like you on my show. And so I think that it might be that other people don't know about it. And I want everyone to listen because this is pretty important information, whether it's you or someone that you know, okay? So you were talking a little bit about the communication part. What you do.
Yes, and the acronym CARES, communication is first. So when you go to a doctor appointment, a lot of times we will take medical records or expect them to read all of our medical records before we get there. The truth is that doesn't happen. There isn't enough time for that. And many times physicians don't have time to pick up the phone and talk to another physician. So that's where the timeline that I put together helps with that communication. It's very quick. Physicians can scan it. I've had individuals take it to the emergency room and the doctors are like, wow, that is so cool. I get it. I know where you've had your testing done, that sort of thing. The other thing is that when you communicate with your physician, you have to understand what they're telling you to do, right? But they also have to be able to hear you. So to go into a physician visit and say, oh, yes, doctor, I'll do that, and not being honest that you're not actually going to do it, you have to have those conversations actually in the room. So I help facilitate those conversations because I go to the appointments with individuals. So I don't come front and center. That's not my role. But my role is to pick up the pieces and ask the next question that maybe the person didn't know to ask, or the physician needs to know, hey, this hasn't worked in the past and they forgot to mention it.
Oh, yeah. A lot of people do that for sure. And now I also wanted to talk to you, too, because it's important that people know this. We had mentioned this when we were off break, because I was asking you, who do you work with? Are they only people that usually have been diagnosed with something? Or do you also help people who are like maybe alone living here and they're older and they have nobody to help them? And you said?
Yes. It's interesting. I'm always intrigued by those people that call me because they're very forward thinkers, right? They want to make sure that they're safe, and also maybe their out-of-state family members don't have to fly in for an event that happens, something that happens. And, you know, also if they live far enough away, they can't get here fast enough.
Something always happens too. Let me just say it does.
It's true. Mm-hmm. It's true. But that's where advanced directives are very helpful. And that's one of the things that I talk to people about initially. I know in Arizona, 5 Wishes is a helps you answer those questions that are required for advanced directives, helps you figure out what it is that you want, and helps you communicate that to whoever you choose to be your power of attorney for healthcare.
Tell everybody who's the person that calls you. Who's the one person that ends up being the first person to call you?
It's usually a family member, mm-hmm. right? Mm-hmm. Somebody that's got something coming up, maybe a surgical procedure. Did you know that there are things that we can do for our bodies prior to a planned surgery? Now, emergency surgery is something different, but a planned surgery, you can find something, right? We can do things to prepare the body so that you get better healing. People that have a new diagnosis or a lack of diagnosis are people that call. I have children that call that say, hey, I need somebody to go with my parents because they are not managing their health care very well, mm-hmm. or I'm worried about their safety. I'm worried about their driving. So it is really putting things in place so that safety is the end result.
So you do a free consultation with everyone. Now write the number down. Maybe you don't think you need it now, but you never know when you need it, or you might need it. And that's why I'm here to give out this information for everybody. It's 480-703-0699. Her website is rnpaofscottsdale.com. She works primarily in the Northeast Valley, and she does free consultation. So I think it's really important that you start off with that call, just in case, you never know. And she can tell you how she can help you, right?
I can. People sometimes come and they don't know exactly what they need, but sometimes just that little bit of information can actually set them on their path.
So what can people do, let's say, that are listening here right now, and they're saying, well, gosh, how can I protect myself like you? This is one of your questions where maybe I don't need someone like you. What do they do?
Well, research is a big thing, right? So researching your physicians. There's a medical website for the state of Arizona. You want to look up your physicians to make sure that there's no challenges with their license, because once you've started treating with somebody or go to a surgeon has a bad, has complaints against them, it's too late at that point. I expect people to pay attention to the medications that they're taking. You can look up things like on RX List or drugs.com to find out what the side effects are to those specific medications, so that if you start to get a side effect, hey, it might be due to the medication. It's not because, hey, I worked out too hard. That statin medication has decreased my CoQ10 and now I've got sore muscles.
As I listen to you, I say to myself that my parents both would still be here if I knew I had someone like you I could call, because you were mentioning the drugs that they administer. My mother had 12 that were added. Right. And I'm thinking to myself, wow, that seemed like a lot, but I don't know what the difference. And, 4 days later, she was dead. And I believe that I believe that. I don't know if I'm right or wrong, but I totally believe it in my mind. And I know when I sit and I listen to you and I've heard other people and I think I'm probably right,
Very well.
Very sad though. It's so sad that there's
preventable.
Something, but you're here. And there's not, and people I'm sure don't know that they can call, that you're not, it's not like they know that, I can call an advocate. I can call an advocate to help me. How do we find out about you?
Well, again, there's more awareness of advocates at this point. There are advocates in the hospital and you can ask for one if you're having challenges within the hospital, but you have to understand who they work for. So what makes me different is that I literally work for the individual. And so I'm not clouded by a physician or a bigger hospital entity. So you get clear information.
And for you, it doesn't matter what diagnosis they've been, dealt, or it doesn't matter?
Not really.
Do you specialize in an area?
I can tell you, I will work with people with any type of diagnosis. I can tell you what really gets me excited, though, is people that are willing to look outside of the traditional medicine and do what we call as integrative medicine or functional medicine, where we can look for the root cause of what's going on. So I can give you an example. I had a young woman who I actually knew from networking, and she said, "I think I need you." And I asked her, why? You look well. And she said, "Well, I've been trying to get pregnant for 6 years, IVF." And she said, "But now I have such terrible migraines and hypoglycemia, which is low blood sugar." And she said, "Now I don't even know if I'm capable of carrying a baby because I don't feel well." What was interesting in functional medicine, we can look down into the biochemistry. There's labs that we can use. I got her to a doctor that does SpectraCell labs, which is the intracellular micronutrient testing. And when she had that test done, she had the lowest level of magnesium they had seen in the last 5,000 patients they tested, which is directly related to migraines. She had a low level of vitamin E, which is why she could get pregnant, but because you need vitamin E for the cell wall, they couldn't continue to replicate, so she would lose the baby. And her hypoglycemia was due to low chromium. So we repleted her, and her baby is now 5.
Wow, isn't that interesting? Talk also about somebody maybe that you helped who had maybe, let's say, cancer or something like that. When they get that diagnosis and they say, "Oh my God, where do I turn? What do I do?" And a lot of people do not want to do traditional at all anymore. They really want to go for something more natural if they can.
Well, we always look at all the options, but I can tell you with new diagnoses, and especially with an oncology diagnosis, when chemotherapy or surgery is required, the first thing I advocate for is a second opinion. Because the first opinion, you may be deer in the headlights anyways. You may not actually be listening. After the word cancer, you're not listening any longer to what's going on, right, and what the physician is offering you. And you have no idea what the next question is. So having somebody with you, either for the first, whether it's a friend, but then making sure you get a second opinion. I just had a young woman who was diagnosed with colon cancer, and we got a second opinion, and the specific treatment was incredibly different with a second opinion.
Just amazing.
Completely different. Medicine is an art. It is an art.
It is an art. Now, when somebody hires you, what would you suggest for the first thing? We're gonna end with this. What should they do?
Well, the first thing they should do, first pick up the phone and call, see if it's a place that they want to go. There's a big issue with trust. I understand people have to understand. They have to trust me, right? They have to trust that I'm looking out for their best interest. But then after that, I always ask that people make a list of their medications, right? And the physicians that they're seeing, because that's the first thing that I'm going to do is go back and look at who's seen them, see if there's anything in the medical record that has been missed, and make sure that there's not drug interactions, and make sure that they understand what their medicines are supposed to be doing for them. Well,
maybe you're listening to this and you're a little confused with what's going on. Maybe you've been dealt something that you never even realized you ever even had, and you got shocked by something. Maybe it is that you have a parent out there that might not be taking care of themselves. Her phone number direct, it's 480-703-0699.